Many people over the age of 50 become concerned when their tests show low calcium levels, when they feel their bones are becoming more fragile, or when they are told they have osteopenia or osteoporosis. Faced with that fear, the most common reaction is to go out and buy a supplement, a stronger calcium, or to start mixing foods thinking that this will help calcium stick better to the bones. I am Dr. Gabriel Mina, and today I am going to explain why that path often does not work and how, with simpler and better thought-out decisions, you can truly support this process through nutrition, as happens with such common combinations as yogurt and gelatin. Welcome to my channel. Here we talk about integrative health, longevity, and natural, very simple habits that help you maintain your physical, mental, and emotional balance. So take note and share this information with your family and friends to help them improve their health. We upload new videos every day, so subscribe and activate the notification bell so you don't miss any updates. Let's get started. When a person decides to consume calcium without understanding how the body works, they may actually be making the problem worse. We often think that if something is missing, we just need to add it, but the body does not work that way. From a biochemical perspective, calcium depends on a very well-coordinated system involving hormones, vitamins, and minerals that interact with each other. It is like a precise choreography that allows a daily balance between the natural loss of bone and the formation of new bone tissue. I have seen cases in my practice where people, with the best intentions, started taking calcium on their own and ended up with kidney problems, cardiovascular alterations, or calcium deposits where they should not be, even in the arteries. That is why, before thinking about supplements, the first step is to understand how calcium is fixed in the body and why it is sometimes lost, even when we are consuming it. Today I want to walk with you through this process calmly. We are going to talk about why calcium is lost, what promotes osteopenia and osteoporosis, and how certain fermented foods, probiotics, and options as accessible as yogurt, when intelligently combined with gelatin, can support this very delicate balance in the bone matrix. I am Dr. Gabriel Mina, a physician, and for years my goal has been to help you understand your body so you can take better care of yourself and also support those you love. I remember the case of a patient just over 50 years old who came in very worried because she felt that everything she ate didn't work for her. She had joint pain, loss of muscle mass, and her test results were not improving. When we reviewed the root of the problem, she understood that it was not only what she was eating, but how her body was absorbing it. That shift in understanding was key to her improvement. I want to welcome you to this space where we talk about health with meaning, without unnecessary complications. Here we will go deeper into how calcium fixation works, why the body loses bone, and how certain daily habits can make a real difference, especially after 50. I also want to invite you, if this type of information brings value to you, to subscribe to the channel and activate the notification bell. That way you won't miss our content and you can share it with someone who may also be going through the same situation. To move forward, we first need to understand the root of the problem. The body loses and forms bone every day. This process depends on a constant interaction between calcium, vitamin D, and vitamin K2. If one of these elements fails, calcium does not fix where it should. That is why today we are not talking about quick fixes, but about understanding the entire pathway. Later on, we will take a closer look at how yogurt, depending on its preparation, can behave differently in the body, and why combining it with gelatin creates an interesting synergy. But before that, it was important for you to understand something essential. Calcium is not handled like a number you simply add up, but as part of a biochemical pathway that requires harmony. On this channel, Dr. Gabriel Mina's channel, we are committed to accompanying you step by step as you improve your habits and take care of your health with clear, practical information. Tomorrow we will have a new video, and I would love for you to keep learning with us. Many people over the age of 50 live with fragile bones, constant pain, or fear of a fracture without knowing that the problem is not just calcium, but how the body uses it. And this is where a little-known but fundamental vitamin comes into play, vitamin K2. When this vitamin is lacking, calcium does not fix properly in the bones and ends up accumulating where it should not, such as in the arteries, increasing cardiovascular risk, bone fragility, and even insulin resistance. I have seen this many times in clinical practice. I remember a patient who came in worried because she had been taking calcium for years and still had osteoporosis. When we analyzed her case, we understood that it was not a lack of calcium, but a clear deficiency of vitamin K2 and vitamin D. Once that was corrected, her progress changed completely. Vitamin K2 is a vitamin that depends on fat in order to be absorbed. In other words, if the intestine does not absorb fats properly, this vitamin simply does not reach the bloodstream. That is why people with digestive problems, pancreatitis, gallbladder surgery, or very low-fat diets often develop deficiencies not only of vitamin K2, but also of vitamins A, D, and E. This significantly affects quality of life and helps explain symptoms such as muscle pain, osteoporosis, fibromyalgia, and loss of bone mass. Here I want you to understand something key. Although part of vitamin K2 can be produced thanks to bacteria in the colon, most nutrient absorption occurs in the small intestine. That is why yogurt is so important. Yogurt is fermented milk, and during that process bacteria produce vitamin K2. Even if you do not see it listed on the label, yogurt does contain it, simply because it is not yet mandatory to declare it on nutrition labels. Vitamin K2 is found mainly in animal-based and fermented foods, egg yolk, liver, cheeses, dark meats, and certain fermented products. Some people avoid these foods out of fear or popular beliefs, without realizing that they are eliminating a key source for bone health. There are also fermented foods such as kefir, kimchi, miso, or even fermented soy known as natto. All of these share one thing in common: the fermentation process, which is precisely what allows vitamin K2 to form. Even fermented beverages such as beer or wine contain small amounts, although they should always be consumed in moderation. And here I want you to pay close attention, because this point is fundamental. Today we are not talking only about calcium. The body knows how to handle calcium. The real problem appears when the vitamins that properly fix it are missing, especially vitamin K2 and vitamin D. Without them, calcium does not strengthen the bones and can become a risk. Many people develop vitamin D deficiency due to changes in place of residence, lack of sun exposure, or metabolic problems. I have seen patients who moved to countries with less solar radiation and, years later, began to experience tooth loss, muscle weakness, generalized pain, and frequent fractures. All because of a silent vitamin D deficiency that was never properly evaluated. When a person has low vitamin D levels, it is not enough to simply take a random supplement. It is essential to understand why it is low, whether there is fatty liver, obesity, digestive problems, or poor fat absorption. Otherwise, the supplement may not work or may even cause adverse effects. That is why, in many cases, the correct approach includes vitamin D3 together with vitamin K2, and in specific situations, calcium and vitamin B12. But this must always be done with proper criteria, because poorly indicated supplementation can lead to hypercalcemia, kidney stones, or heart rhythm disturbances. Here I want to pause and remind you of something important. Not everything that is natural is safe if the root of the problem is not understood. Taking supplements without proper guidance can be just as risky as taking nothing at all. That is why it is essential to look for an approach that analyzes the real cause and not just the number that appears on a lab test. If this content is helping you better understand what is happening in your body, I invite you to subscribe to the channel, activate the notification bell, and share this video with someone who may also be concerned about their bone health. Sometimes, this information can make a big difference in the life of someone close to you. In the next segment, we will continue to go deeper into how the body works when there are vitamin deficiencies and why quick fixes are not always the best option. Many people over the age of 50 begin to notice nighttime cramps, stiffness in the arms and legs, cracking sounds in the joints, or muscle weakness, and they believe it is all due to aging or a lack of calcium. But the reality is different. The problem is usually not the amount of calcium, but the fact that the body can no longer fix it properly into the bones. And today you are learning how to address this by understanding vitamin K, vitamin D, and the way you combine your foods. When the body needs calcium for other tissues, such as muscles, it activates cells called osteoclasts, which remove calcium from the bones and release it into the bloodstream. This works for a while, but there comes a point when that reserve is depleted and symptoms begin to appear: frequent cramps, stiffness, joint pain, and the sensation that the bones crack when moving. Many times this happens because, without realizing it, we make decisions such as completely eliminating fats from the diet. And here is something key: the only dietary source of vitamin K is fat, because it is a fat-soluble vitamin. Without fat, there is no vitamin K, and without vitamin K, calcium cannot be fixed. Vitamin K is not only found in animal fats, it is also present in fermented foods. And who produces this vitamin in fermented foods? Microorganisms. That is why properly used fermented foods are so valuable. Now let's talk about vitamin D, because its function is more complex than it seems. It is not enough to get sun exposure or to ingest it. Vitamin D depends on three processes: that it reaches the body, that it is properly distributed in the blood, and that the body is capable of activating it metabolically. Its production depends on skin type, age, where you live, and actual exposure to ultraviolet rays. But in addition, once it enters the body, it must go through several transformation stages until it becomes active vitamin D3. Here is something very important. A person with chronic low-grade inflammation almost always has low vitamin D levels. And that inflammation is part of aging. That is why when someone buys vitamin D on its own, without understanding their context, they often see no benefits. The body does not activate it. All of this also depends on nutritional factors, especially adequate intake of vitamin K2. It is not just about taking something, but about understanding how that substance is absorbed, distributed, and metabolized. That is what we call kinetics. From a biochemical standpoint, problems can occur at three levels: how much you consume, how it is distributed, or how it is metabolized. Not everyone fails at the same point. But when someone wants to fix calcium, they often make the wrong decisions. They start eating healthier, but eating healthy does not always mean taking care of your health. That is one of the most common mistakes. Then combinations appear, such as thick yogurt with fruits, chia seeds, oats, granola, banana, grapes, raisins, all mixed together, thinking that this will strengthen the bones. Or the opposite extreme, only proteins and fats mixed together without criteria. In both cases, the same thing happens: molecular convergence. In other words, many molecules from the same group or from different groups are mixed without biochemical order. This generates repeated insulin spikes, low-grade inflammation, and as a result, poor activation of vitamin D. The outcome is the opposite of what is intended: more bone loss. Here I want to be very clear. The problem is not yogurt, fruit, or chia. The problem is mixing them without biochemical logic. That combination increases inflammation and blocks the benefits. That is why today we are talking about protein yogurt, specifically real Greek yogurt, properly selected. When you add sugar-free gelatin to that protein yogurt, you increase collagen intake and promote an ideal environment for vitamin K2 and vitamin D3 to do their job. The first step is to properly classify foods. Then, combine them correctly. This is not a diet, it is a way of understanding how molecules dance inside the body. It is knowledge that I have been studying and applying for more than 17 years, with thousands of real cases. And I'm going to show you something very practical. Imagine a protein Greek yogurt. To that, you add a simple fruit, for example strawberries, which provide the carbohydrate. Then you incorporate a fat, such as shredded coconut. You now have three well-combined molecules without molecular convergence. After that, you add sugar-free gelatin, liquid or solid, depending on the texture you prefer. You can even add a sweetener such as sorbitol, which does not raise insulin and helps intestinal absorption of vitamins like D3, K2, and calcium. This is a molecular gold combination. It is useful for people with hypocalcemia, osteoporosis, osteoarthritis, osteopenia, or those who have had thyroid or parathyroid surgery. It is not a medication, not a supplement, and not something strange. These are common foods, used correctly. I have seen impressive changes simply by eliminating molecular convergence for 1 or 2 weeks. People who stop having cramps, experience less pain, and gain better mobility. And to evaluate this, we use body composition analysis because it reflects the real state of the body's biochemistry. I remember the case of a young patient, 31 years old, who came in after thyroid and parathyroid surgery. She had joint pain, inflammation, and severe problems controlling calcium and vitamin D. Although her weight did not seem alarming, she had a large amount of visceral fat and a fatty liver that prevented proper activation of vitamin D. By eliminating molecular convergence and working on her nutrition correctly, in less than a year she completely changed her biochemistry, reduced fat, improved her liver, and restored mineral balance. The problem was never a lack of calcium, but not understanding how the system worked. And here is the final message. It is not about randomly buying supplements. It is about understanding the origin of the origin. Understanding how calcium, phosphorus, vitamin D, and vitamin K interact. Properly classifying foods, combining them with purpose, and respecting the body's biochemistry. If this information has helped you, I warmly invite you to subscribe to the channel, activate the notification bell, leave a comment, and share this video with someone who may be going through the same situation. Every day we upload new videos designed especially for you, to support you and help you improve your health in a practical and conscious way. Before we say goodbye, I want to invite you to pause for a moment and give thanks to God for life, for your body, and for the opportunity to learn how to take better care of it. Knowledge is also a form of healing. On Dr. Gabriel Mina's channel, we are very happy to be able to contribute to your well-being and to the improvement of your daily habits. Tomorrow we will have a new video carefully prepared for you. We look forward to seeing you here, because your health matters to us and this space exists to walk with you on that journey.